Insomnia is a condition where an individual has either trouble falling asleep or once asleep, has trouble staying asleep. A good night's sleep for normal people will help them to wake up refreshed. But people suffering from insomnia would often wake up with a dull feeling due to a restless sleeping pattern. While the exact amount of sleep needed by each individual differs widely, most people would normally require about 7 to 8 hours of a good night's sleep to function normally during the day. The lack of sufficient sleep can in turn affect an individual's capacity to function efficiently. The level of energy, the person's mood during the day and the general health of the individual can be affected in the long run due to insomnia. It is estimated that 33% of people worldwide suffer from this condition. The symptoms of the disorder would include difficulty in falling asleep, waking up often during the night, waking up well before normal waking hours, experiencing attention deficiency and fatigue the following day, waking up with a headache and many other symptoms. Insomnia can result from a number of causes, but the most predominant cause is a stressful lifestyle. There is too much hectic activity going on in a person's life during the waking hours of the day that it makes it difficult for them to slow down enough to rest peacefully at night. Most people carry home their tensions and their burdens from work home, which makes it difficult for them to get sleep as soon as they get to bed. There could sometimes be a medical condition involved, but this is not the common cause for insomnia. The medication that people take for their other ailments can also induce sleeplessness as one of the side effects. So it is necessary to first determine the cause of the sleeping disorder before we can start treating it effectively. But sleeplessness can be easily cured with the right diagnosis. There are two types of insomnia, i.e., primary insomnia and secondary insomnia. In primary insomnia, a person suffers from sleep-related problems that are not a side effect of any other medical condition. The sleep disturbances in primary insomnia are not the cause of any other medical disease, whereas secondary insomnia occurs as a side effect of other health-related problems. The cause of primary insomnia is not known. Secondary insomnia includes acute insomnia and chronic insomnia. Different medical conditions and diseases can cause secondary insomnia. Apart from medical illnesses, pregnancy, drugs, uncomfortable sleeping environment, and mental dissatisfaction are also the primary causes of secondary insomnia. The acute type of insomnia can either be short-lasting or long-lasting. Its duration may be from one night to some weeks. Most people experience this type of insomnia, but it gets better on its own and does not require any medical treatment. Different factors, including stress, medications, caffeine, nicotine, diseases such as sleep apnea, or disruption of the normal sleep cycle, can cause acute insomnia. Acute insomnia usually does not require any treatment. Going to bed early, avoiding tea or coffee before going to bed, and sleeping in a comfortable room helps in preventing and curing insomnia. Listening to soothing music can also induce sleep. In chronic insomnia, a person has episodes of insomnia lasting 3 nights per week for 3 months or for longer than 3 months. Psychiatric problems mostly cause chronic insomnia. Therefore, depression, anxiety, post-traumatic stress disorder, or severe stressful conditions can cause chronic insomnia. The treatment of chronic insomnia consists of finding the root cause of the problem causing insomnia in the first place. Some drugs help in avoiding lethargy caused by insomnia. Sleeping pills can have adverse effects. Therefore, patients should not take sleeping pills without a doctor's prescription. Cognitive behavioral therapy, along with the medicines prescribed by the doctor, is also useful in treating chronic insomnia. Proper sleep is necessary for maintaining health. Lack of sleep can increase the risk of several diseases like diabetes, cardiovascular disorders, and obesity. It can also cause a person to age rapidly. It also impairs a person's cognitive abilities, concentration, and learning. And a difficulty in memory retention also occurs. Therefore, if you have the symptoms of insomnia, you need to visit a doctor to get rid of it or to make it better as soon as possible. Drop a comment below. Give us a thumbs up and remember to subscribe to our channel. Thank you so much, smiley face.